Hey there, healthcare humans. Thank you so much for coming back for another episode of The Other Human in the Room. So, today I want to talk about a topic that I feel awkward discussing. Maybe that's true of every topic that I cover on this, because as you know, the goal of this podcast is to reveal the more human parts of ourselves. And I think a lot of when we talk about things being weird or awkward or messy, we really just mean human because we've all been sort of conditioned to believe we need to be neat and tidy and put together, and never awkward. But like humans equal awkwardness, let's be real. So in this case, I want to talk about money. Um, it's something that I have done a lot of reflecting on over the past year, especially, and all of the shame that I have about money. And I think there's stuff that's perhaps unique to me, but I also think there's a lot of the money stories that we've been handed that are really social conditioning, that are the inhuman stories that kind of keep us stuck. And um, I just want to talk about some of them and sort of open the conversation about it, and the ones that I notice are most intense for myself as well as for other people that I talk to, in hopes that it can shed light on the fact that you're not alone if you have these money thoughts, and that there's a way to shift them. There are ways to come to be more at peace about your money. Um, so I would say for people who work in healthcare, there's a kind of morality and judgment about making money that does not serve us individually. And honestly, when you think about, who does this mindset serve? It certainly serves the people who pay us, our employers, in my case, sort of the Ministry of Health, the people who decide how much physicians should earn and how. I think a lot of how we've been kind of conditioned to view ourselves is that we shouldn't want to make money for what we provide for patients. Of course, none of us actually would work completely for free. So it's sort of this absurd mindset that you like when you follow it all the way down, you're like, well, no, I wouldn't work for free and do what I do. But there's this sense that like if you were truly like the most enlightened healthcare professional, you would work for free. This would be your calling. This would you would be, the healer of all the people and would never receive a dime for your services. And you'd be like, Mother Teresa or someone, something, right? And just like and so it comes up in a way where, we receive money and maybe we feel guilty or shame about receiving money. We feel awkward and like we shouldn't even really look at the money we receive or like know too much about it. And if there's a case where an opportunity comes up for us to do something like give a talk or teach local medical learners or whatever, the notion that it should be done for free, like join a committee, right? It's seen as sort of selfish and greedy and countercultural if you are asking to be compensated for the time you spend doing something. Yeah, there's all this like kind of apology, guilt feeling about asking for money for sure, asking for raises for sure, and even just receiving the money in general. For me, I until this past year, I always have been managing the money that I receive for being a physician. And I looked at it enough to know, that I had more coming in than going out. So I was, not bankrupt. But I always had this like sense like I shouldn't look at it too closely. Like my brain would almost like blank out when I'd try and like figure out how much I am making and try and predict how much I will be making and thinking too hard about money. I was always like, I'm just sort of bad at money. I don't really know what I'm doing. I had this whole story about it. And this training that I'm currently doing, which is like sort of in a feminist lens on coaching, because, that's one of the modalities I practice to help people is through coaching them. Talks about how this is explicitly a money story that is taught to those socialized as female. Which isn't to say if you're listening to this and you are raised male, you won't have this story. I think there's also other elements. Like another element in my personal story is that I was raised by parents who made money. They're actually both physicians, And we were raised evangelical Christian, where there's a lot of like, don't, being rich means you don't get into heaven, kind of, except give money to the church. I won't go into the whole thing, but like just to say there's like multiple strains. It's not purely because I was female that I got these stories, but I think certainly in society in general, knowing the fact that if you are female, if you have other marginalized identities and have lived in the world for some time, notice how the ways that people have treated you around money or the stories that you learned around money, and really just sort of like exploring those, you may get a bigger insight into why you have the reaction you have to money now. And if you feel embarrassed by money, or if you feel shame about what you don't know about money, and especially that bit, like if you think about it, if you happen to have a money story where you're bad at money, where you don't trust yourself with money, where you have to defer to the authority of others who know more about money than you, like really pay attention to those stories, because those stories really serve someone else besides you. Yeah, like like interesting that like on average, women may defer to men in their lives about their money. Who would that benefit, right? Like if you are thinking that you're not confident, then someone else will be a better steward of this money resource, right? And so just that whole piece of it, like the fact that so many of us feel like we're a bit uncomfortable with money, don't know what we're doing with money, that we need to defer to others in order to understand our money. There's like those elements. And then it's in the healthcare where you're like a helper person and you're like supposed to just be so generous and giving, and you're not in this for the money. Then talking too much about money makes you greedy. It means you're in this for the wrong reasons. It makes you selfish. All these words that like we've explored, also apply to you if you just like take time off of work, or like have a way you want to change your practice that serves you better, than you're greedy and selfish, right? Like, so notice the same kind of stories arise. And really the thing that all these stories have in common is that they don't allow you to take ownership over that part of your life. So in this case, all of these stories and these things we've been conditioned to believe about money really do us a disservice in taking ownership of the fact that we make money, because we make money. This is our profession. This is our job. This is the goods and services we offer to the world in exchange for dollars. Yeah. And there's something where when we start to peel back these socialization layers and actually understand what money really is, that things get a lot clearer. And I will be honest, for me, it's been this process. So like, before I ever started any coaching stuff, I would do my bookkeeping and I would understand that I made enough money to pay myself and was quite so I understood enough about it. But I had this story that I was bad with money. And then I opened this restorative medical education and coaching business where like one of the intentions was to receive money from others, understanding that I was providing a service to others, and one way that I could sustainably offer that and actually then use the resources of money others give to me to invest in other aspects of impacting healthcare, whether it's developing further resources, whether it's like literally giving, investing in community, charity, whatever, like whether it's investing in myself and, all these things. So I had to really look at money in a new way. And well, I didn't have to, but I wanted to. I wanted to kind of change my relationship with money. And I had this old, bad with money story, and I just started to disrupt it. And I'm not like now totally at ease with money per se, but it's been this process over this past year of like, honestly, the tell that I wasn't really yet at a place of peace with money is that I would not look too closely at my money. I would not know how much I was making. I would not know or have even just a ballpark sense of what my expenses were, And when I would ask myself why, or I'd get coaching about why, it was like, I'm just bad with money. My brain just goes blank. I just get so anxious. And I had so many stories tied up in what it meant that I made, $1 amount versus another dollar amount, and what money means to me. And none of that was serving me, because like then I really couldn't understand literally how much money I made, what my expenses were, and like you know, so I was making choices with how to spend my money, for example, without actually understanding if I had that money to spend, if that was an intentional choice I would make, if I knew this was a third of what I'm making this month, is that what I would want to do with this money? I didn't have any sense of the scale of the things I was paying for. And just like notice how that is often the case. Like I think a lot of us, we're very, we receive a lot of advertising. We receive a lot of opportunities to give other people our money. And it certainly serves all of them if we don't really have a sense if that's the money that we don't. I don't think a lot of, the quick fix, pay me money advertisers really are hoping that we pause and consider if this is an investment that makes sense to us. They want us to just sort of impulse buy, right? Like there's that whole sense. And notice how that is certainly true for men and women, but like, hello, there's a whole multiple industries that are kind of like about like, how can we induce women to impulse buy, right? So just noticing all of that, and especially in terms of also looking at how much I make in healthcare. I did want to make some intentional investments, including like hiring more people to help me with caring for my patients, and looking at how that would be a sustainable way for me to practice that is like more in line with like what I want for myself, right? And so I actually think it was that, like deciding to make an investment for more humans to help me provide healthcare, that was sort of the last of the domino pieces that really allowed me to focus in on a clearer level of how much do I make, how much am I spending? Because I realized like this is the truth that I have come to about money, right? You think about all the inhuman stories where if you care about money, you're greedy. If you care about money, you're selfish. Money is bad. It means you're a bad person. Like all these things that we have caught up in. But really what money is a resource. It's this thing that our society uses to approximate the value of a service provided and a service received, and or a good provided and a good received. We have collectively somehow decided apples and all the things that it takes to grow the apple and pick the apple and cart the apple equal that apples are these many dollars, and it's all very complex about the reasons why, but like that's why apples cost what apples cost, if you will, right? And so when we think about what we do in healthcare, so whether you're paid a salary or fee for service or like however you receive income for the work that you do, it is because someone decided, or a series of someones, decided, well, when one human provides this set of services to another human in order to help support, maintain their health in these ways, this is what we collectively want to offer them in exchange for that, as sort of, you could say, incentive to keep doing that, or this appears equivalent in terms of the services offered versus the dollars we give you to receive for those services you've offered. Like it sounds very kind of not dramatic and dry, and that's because that's what money really can be. Acknowledging, of course, that we live in this sort of capitalist society where in a version of society where not everyone has like the minimum amount of money they need to pay for like basic necessities. And that's like a real issue. I'm not going to get into what I believe politically about that, but it's an issue, right? And I think a lot of us, even if you objectively make much more than that minimum baseline of what we need to survive, we've all got this sort of scarcity mentality that we might not have enough money, and what money means, and that it's a failure if we don't make enough money, or if it's a failure we make too much money. Like it's sort of, you can't win, and we all have versions of that story. And so my first question to you is, reflect on that. What is your money story? Like, what is the story that you have been conditioned to believe about yourself when you make money, yourself when you spend money, what it means if you make more or less, say, than another person, when you notice someone else spending money that when you do the math, you would not be able to afford, like all of these stories. And, not just as a thought exercise, but because it really can impact our experience of doing our work. Because a lot of us start to have this sense that if we don't make enough money, we are devalued as a person versus that our service is devalued. And so then we can feel very, harmed and attacked and personally drained by the fact that we don't make what our brain considers the correct amount of money for what we offer. And the thing is, it could be true. I think a lot of people, everyone in healthcare, certainly people say like people who are paid the least, like whether it's PSWs or like ward clerks or the lowest paid medical professionals like physicians, like it is a bit absurd that there are such a variety of payments we receive for this work of like tending to the health and well-being of other people, and it really doesn't serve us if we think, oh, if we're not paid enough, that's received as a message of I'm not enough. That actually makes it harder to, for example, ask for more money or advocate for yourself for more money, because it's like you're having to advocate for your own worth and value as a person, So again, we bring it back to what I was saying. Money is a resource. It's a resource that is used in exchange for goods and services. That's exactly what it is. It is the drama around money, the folklore and mythology around money is so much more emotional and so much more wild than that. And it has been so freeing to like get through the layers of all of the drama of the messaging I've received. And there's like multiple layers there. In fact, there's whole like podcasts that are specifically about like money and medicine that are very interesting and sort of tease apart all the different stories. And I just would invite you to consider which stories are present for you and what happens when you pare back the notion that like the dollars you receive. I also like saying dollars versus money. There's something about that. So like the number of dollars you receive, the number of dollars that you then spend, invest in, or, that you give out in exchange for things that you then receive, right? What's your relationship like with that when you drill it down to that sort of neutral circumstance, that math problem of dollars in, dollars out? Yeah. It is so freeing. Right before I decided to record this podcast, actually quite spontaneously, I sat down to do what is now a pretty much weekly practice of bookkeeping and tending to my money. I think of it kind of like a garden where I'm like, how much came into the bank account? How much came out? How is this particular resource doing in my life? Just the way I would spend, I do spend less time doing this, but like I will check my gas gauge. I will see, do I need more gas in my van, right? Like yes or no. And that's another resource that if I don't tend to it, suddenly I'm running out of gas halfway to work and it's a problem, right? So it's similar to that with money where it's like, well, how is this resource doing? Say I had a garden, I'd be like, how are the tomatoes growing? Like it can really be sort of viewed in that way. I have way less of the shame and anxiety than I used to, but it took time. And so, I just want you to know that's possible in case you, like me, have a really intense money story and that it feels really yikesy for you. What happens if you kind of clear the air and really think of the dollars in as the resources you're receiving in exchange for goods and services you put out there, not in exchange for your worth as a person. And then the dollars that you offer to others in exchange for goods and services they offer to you. Like, what if that's all that's happening? Yeah. It could really change a lot. Like I have had coaching clients, had one recently where, they are a locum and they are taking a lot of jobs or feeling like they should take more jobs or really feeling like they need to nonstop work because they just need to keep making more money. And when we check, we're not sure how much money they actually need. Right? I've had other clients where it's like, I don't think I can keep working at the level I'm working, but I'm afraid of cutting back to part-time. I'm afraid of leaving this job for another job that pays less because I think I won't be able to afford it. But when we look, they do not know. They have not done the math to understand if literally they could afford it or not. Because just like you can put in a spreadsheet or, add up the dollars that go into your bank account, you can add up the dollars that go out of your bank account every month. And that's at least an estimate of, well, I know I need at least this much plus or minus buffer or whatever. I'm not a financial advisor, but this is the kind of math that actually all the financial advising comes down to. It's like, how many dollars are coming out every month? So then how many dollars do I need to cover that? That's sort of the bare minimum. And then you can go up from there. Of course, people like spending money on other things, but like often when you actually do the math of it, you realize like, oh wow, I don't need to work as much as I thought I did so I don't need to work as much as I thought I did for money. Then it becomes a case of how much do I want to work? What would feel delightful to work this amount and not more and not less, but like for other reasons, right? So it really gets you past that financial scarcity roadblock of viewing yourself as trapped in a job in healthcare because you think you need the money and there's just no possible way you could survive with less money, you know? And so really looking at that directly and looking at all the stories you have around it and doing the math of the dollars you make and the dollars you routinely spend, you know, then you can make a more informed decision about what happens next. That's not reactive and emotional and laden with guilt and shame about all the ways you're quote unquote bad with money. So that's my solution, if you will. Like it's actually a pretty simple but not easy solution to money shame. Because the thing is, actually, money is quite simple. It's dollars in, dollars out, like I said. So like the steps are really recognizing how many emotions come up when you try and look at your money and like kind of just getting to know them. And for me, that took several months or even over a year of just like gently like allowing myself to look at one piece of it at the time and like get coached on different pieces of it and like just sort of like let each layer sort of, you know, slip to the side as it was ready. You know, there are tons of people who do a bunch of coaching specifically on money because there's so many mentalities and mindsets that's useful to shift, you know? And so spending a bunch of time with all those inhuman stories and identifying which ones come up for you and no longer believing them, no longer letting them run the show and centering in the reality, which is money is a neutral resource. It is neutral in the sense of it's not a moral value. It's not about your value as a human. It is a resource that allows you to exchange goods and services for things. Well, it allows you to exchange for goods and services, I should say. So how many goods do you want? How many services do you want? Do you have the dollars to make that happen? Right? And so that's what's happening. That's sort of the fact check healing human story here. Money is a resource. And then how do you actually start embodying what could be possible for you if that's all money was? What would you do differently in your work? And like, how would you act differently? How would you show up for work differently? How would you look at your billing differently? Would you stop underbilling, for example, because would you change how you charge for private services if that's part of your care, right? Like, would you either charge more because you realize you've been undercharging because you feel guilty for asking for dollars in exchange for your services? Would you create different equitable ways of offering private services, sliding scale? Like none of these are morally better or worse, but like if you just looked at it and looked at your values and knew that all that was going on is you're trying to decide how you wish to manage this resource called money in exchange for services you're offering, and then in your personal life, like in exchange for services you're receiving, like how would it change things? Because for me, it has changed so much. I never thought I could afford to hire NPs in my practice per se, because I just assumed I was so bad at money and I just had I like wouldn't even myself look. And so I've looked and I've realized, wow, I can. And how will that be to my benefit? How will that allow other ways that I earn income to grow and flourish so that overall I can be a steward of even more of this resource? Not so I can, you know, well, I don't even want to sort of, I was about to like apologize for the fact that one of my goals is to steward more resources, but I don't want to do that because that's the other thing, like especially in terms of women versus men or in marginalized folks versus not centered, you know, folks with more privilege. Like if we're actually going to shift this system, it is to the benefit of all of us. If those of us that want to bring more humanity to this system also have more of the dominant resource that creates change in the system, which, well, one of those dominant resources is money, right? And so one of the reasons, for example, I like don't offer everything I offer in coaching and education for total free is because I am intentional about growing how much of this money resource I am bringing in, with the dream and hope that like what I could be building alongside of others doing the same could really have an impact on the healthcare system, including whether I'm like literally investing into the healthcare system with the dollars I've earned, or whether I'm using it to increase my impact of how many healthcare humans I can serve, like all of that stuff, you know? And so that's part of what is possible if you take a look at your money story and take a look at what you've been conditioned to believe about money and learn to shift it. Yeah. And it doesn't have to be a moral thing, good or bad. It can simply be this resource that you're stewarding. And, you know, hey, if you then look at your numbers and you realize, I have this amount of this resource to steward currently, and what do I want to intentionally do with that resource, right? What is within my values? What do I want to center as how I want to invest this resource as well, right? There's so much that can be explored here. So yeah, that's what I wanted to offer all of you this week, is just wanting to name how many layers of shame stories and inhuman stories we have been conditioned to believe about money, getting really clear about all that money is, and then inviting you to imagine what your life looks like if you're not constantly worrying about money, because you realize what it is and you realize what it like can and can't do for you. Can't buy you self-worth, but it can buy you an apple or whatever, right? Like, what can it do? How would your work differ? How would how you shift your work differ? How would how you spend money differ, right? Like it can make a huge difference because it is the dominant resource we use in interaction with other people, right? In terms of exchanging goods and services. So something to consider. Yeah. And I don't have an ending to this. I'm just noticing. I'm like, how do I want to sum this up? Okay, so my summary to you all is really reflecting on these questions. So number one, what is your personal money story? What do you notice happens when you talk about money to other people? What do you notice happens when you try and do your taxes or do your financials? And what stuff comes up for you? What emotions come up and what stories are tied to those emotions? Yeah, and same with spending money. What stories come up? What emotions come up when you're thinking about money in this way? What happens if you peel those back? Number two, what happens if you peel those back and look at money as purely a mass thing, purely a resource thing in exchange for goods and services? If you neutralize the whole thing, what happens to how you view your behavior, view your life, view these dollars and what they mean for your life, right? And then if you're at that neutral place, the third question is, what would you like to create in your life, including whether it's like literally investing money or asking for more money, but from this place of understanding exactly what it is, a resource, something that you then can use to invest and resource other people. If that's all that's going on, how do you want to use it? Yeah. I would love to know your answer. So if you listen to this podcast and you're curious, please reach out and connect with me. And I would love to hear what stories are out there. And yeah, otherwise, that's your podcast for the week. Lots to think about. And I'll see you next week. Take care.